Well, the obesity epidemic is not really so recent. We have been gaining weight for more than 100 years in this country on average. But as we continue to gain weight, the number of people that cross the threshold into what's being diagnosed with obesity has gotten more and more. And clearly it's a change in our lifestyle where we're eating more food, more energy-dense food, and having less physical activity. And so a combination of those two factors really have increased body weight in our population. So having excess body fat does have physical effects. It impairs mobility, ability to function, and perform daily activities. It also can put pressure on certain organs like the lungs and reduce lung capacity and ability to breathe well. But the most important aspect of having excess body fat is its metabolic effects and its effects as a risk factor for various diseases. In fact, there's no organ system in the body that's not adversely affected by having excess body fat. And if we can understand that link between why excess fat causes diabetes, heart disease, stroke, kidney disease, pulmonary dysfunction, amenorrhea, infertility, cancer, will really go a long way into blocking that relationship between the two. Fatty liver is really becoming a major health problem in many countries throughout the world. In the United States, about 1/3 of adults have increased triglyceride or fat in their liver. And the more obese you are, the more is your risk for having excess fat in your liver. It's also regulated by ethnic and racial background also. Having excess fat in your liver is associated with metabolic dysfunction, increased risk of diabetes, heart disease, and increased blood pressure. It also can lead to liver damage with fibrosis and eventually cirrhosis. So now having excess fat in the liver is one of the most major causes of liver transplantation in the United States. So reducing liver fat by having people not become obese is really the most powerful mechanism of preventing fatty liver disease in people. So having excess liver fat can be diagnosed by imaging techniques. Specialized techniques called magnetic resonance spectroscopy can actually measure how much fat is inside of your liver. An ultrasound procedure can give you an indication, but the real diagnosis, the gold standard, is the biopsy of the liver. So taking a piece of liver tissue, looking at it under a microscope, will tell you how much fat is there, as well as if there's inflammation, fibrosis, and even cirrhosis of the liver. The treatment for fatty liver is really weight loss. So the liver responds very, very dramatically to losses in body weight. And even a few days of calorie restriction can cause a marked reduction in liver fat content. But losing as little as 2% or 3% of your body weight can reduce liver fat. And so if an obese person has excess fat in the liver, weight loss is really the key treatment. So what's really amazing is that even children and adolescents who are obese develop fatty liver. In fact, there's a case of a 9-year-old child who is obese who develops cirrhosis of the liver because of fat in the liver. And so diagnosing fatty liver in children really tells you who to target for aggressive therapy for weight loss. If you take a child who's the same sex, the same Tanner stage, and the same obesity, but one child has fat in the liver, the other child has normal liver fat content, that child with fat in the liver is high risk of developing metabolic disease and really requires much more aggressive treatment medically than does a child who does not have fatty liver. That can only be diagnosed by imaging techniques or taking a biopsy of the liver. So that's really so improving our diet is a difficult thing, but there's two aspects to diet to making beneficial change to our diet. One is the calorie content of the food, and that determines whether you become obese or can lose weight or stay lean. So it's just calories in and calories out. So portion control is really critical for that in terms of not eating as much calories and having enough calories to maintain a healthy body weight, but not excessive calories, which will make you gain fat over time. It takes very little energy and balance to gain weight. If you eat 10 calories more a day than you burn up, that's the amount of calories roughly in a lifesaver, you'll gain about a pound of fat over 1.5 to 2 years. So if you eat a couple extra lifesavers a day, you can see how much weight you'll gain, over time. The key then is, in addition to the calorie content, is the composition of the diet. So there are some foods that may cause abnormal or unhealthy metabolic responses and other foods that are really more healthy. So diets that are Mediterranean style diets where you have nuts and seeds and olive oil can actually have healthful, beneficial effects in preventing heart disease, even at the same calorie content of another diet that might have a lot of refined sugars and refined and processed foods. The key for preventing obesity and treating obesity is really making lifestyle changes. But this is very, very difficult. To make lifestyle changes in the current environment is difficult. So even bringing people in for therapy for 1 hour a week is not easy when they're bombarded 24/7 with our environment to eat more food and be sedentary. But if we can make successful behavior changes, which requires constant vigilance, constant monitoring, that's really the key of reducing calorie intake, maintaining a healthy diet composition to prevent the need for bariatric surgery, which really is our best treatment currently for treating obesity. But if someone is very obese with complications of obesity, bariatric surgery is the most effective therapy we have available. Unfortunately, bariatric surgery cannot be used to treat everyone who has severe or extreme obesity. There's not enough surgeons around, enough money in the bank to pay for all of those procedures.